and your action here today is just one part of a huge range of activity that's taking place across the world in this global period of intense awareness raising and activism. Together we can make a difference.
Violence damages health and well-being, and it is a key public health issue. And that fact is recognised internationally, with the World Health Organization highlighting that violence against women and girls as a major public health problem and a violation of women's human rights.
Violence against women and girls includes domestic abuse, rape, sexual assault, stalking, commercial sexual exploitation, including prostitution, and so-called honour-based violence, including female genital mutilation and forced marriage.
In the UK, domestic abuse will affect 1 in 3 women and 1 in 6 men through their lifetime, leading to 2 women being murdered each week and around 30 men per year. And it is the most single-quoted reason for becoming homeless.
And we also know that violence against women and girls is exacerbated by other forms of inequality. Disabled women are twice as likely to experience men's violence as non-disabled women. 83% of trans women have experienced hate crime at some point in their lives. Black and minority ethnic and migrant women face higher levels of domestic homicide and abuse-driven suicide.
In Scotland, around 60,000 of incidents of domestic abuse was reported between 2017 and 2018.
We have a situation where women and girls are still not equal, are still subject to harassment and other forms of male violence. We all need to work together, and it needs effective leadership at a very high level.
And I suppose if we actually take the idea of sexual violence against women as a public health issue, for me it's straightforward, it is. I think the point of today is how do we make that meaningful for Public Health Scotland going forward.
We have public health specialists and a number of violence against women local area partnership coordinators in the room too. These coordinators work to ensure every local authority has an engine room through which the local response to tackle gender-based violence is driven forward and joined up to the work of community planners, health and social care partnerships, community justice and community safety partnerships.
The Scottish Government is committed to tackling violence against women and girls and is implementing Equally Safe, which is our co-owned strategy with COSLA to prevent and eradicate all forms of violence against women and girls.
Now, Equally Safe recognises that violence against women is rooted in structural gender inequalities and therefore requires a whole population approach to address it. If we are to achieve Scotland's public health priorities, we need to recognise violence against women and girls as a public health issue, and that's what we're here to do today.
And equally, the public health priorities are not solely for public health professionals. They're intended to be a foundation for the whole system, for public services, for the third sector, for community organisations and others to work better together to improve Scotland's health and empower people and their communities.
It's not just down to one agency about improving Scotland's public health, it's Scotland's problem.
But it's a strategic, coordinated and long-term approach involving a full range of statutory and voluntary agencies in a multi-agency setting. It involves a true partnership approach where people buy into that. It addresses the causes and doesn't merely respond to individual incidents and or cases.
Gender inequality, violence against women and girls needs to be visible as the future public health landscape evolves and increasingly drives change across our public services if we are to improve outcomes for our population as a whole.
And we need to influence public opinion in a long-term and consistent way.
And our collective challenge today and moving forward is to ensure that violence against women and girls is given prominence and focus in how we tackle Scotland's public health challenges.
No guilt, no shame. I am not to blame.